Your electrosurgical generator is an important part of your endoscopic submucosal dissection procedure, and you need to understand what the different settings are and what they do. Recent studies suggest that the type of electrosurgical energy you use often doesn't make much of a difference in terms of the final outcome, but it does make a difference in terms of the appearance and therefore the interpretability of the defect, and it does make a difference in terms of the use of cut versus coagulation. So let's start with cut versus coagulation. Cutting current is mainly used to transect tissue without providing too much burn of the tissue while doing a cutting. This current is usually used for snare resection of flat adenomas, and it's also used for the incision phase of endoscopic submucosal dissection. It provides a very clean cut through the mucosa, which is very difficult to achieve with any kind of coagulation current. Then for EMR, or endoscopic mucosal resection, you have the coagulation currents. Very rarely are we using forced coagulation in endoscopic mucosal resection. We are using soft coagulation, both to control bleeding, either with the tip of the snare or with a coagulation forceps, a hemostatic forceps, such as a coagrasper. The settings for that are very specific to the individual generator, and you should follow the manufacturer's guidance in terms of which settings to use in which situation. Then if you're talking about pedunculated polyps, then forced coagulation is often used, but it is really up to the practitioner how they apply that. And that definitely depends upon whether you've used a ligation device or not as to which type of current that you will apply there. For the coagulation phase or the dissection phase of ESD or endoscopic submucosal dissection, there are multiple types of current that you can apply, and most people are not using pure cut current to do the dissection phase because of the increased amount of bleeding that occurs because of that. So a lot of people are either using a combination, a blended type of current between cut and coagulation to perform that phase. Of course, also in ESD, there is the need to coagulate blood vessels, and so the soft type of coagulation is very useful for that kind of activity where you want to either pre-coagulate or coagulate bleeding vessels.